Hello, my name is Katie Wilkins, and I have created this video for my Nursing 564 class, Contemporary Healthcare Environment. So first off, I will give you a short synopsis of my career in healthcare. I've been a nurse for almost 10 years, and approximately the first 5 of those years were spent working in acute care, and the last 4.5 years I have been working in an outpatient setting. For the purpose of organizing my thoughts, I have created 3 sections related to my philosophy, ethics, politics, and then the legal system related to nursing and healthcare. And naturally, there is some overlap. Okay, so ethics. First and foremost, as a nurse practitioner, I think it is most important that my patients and I are working together as a team. This most definitely supports the idea of patient-centered care. Our relationship should be built on trust and one in which the patient does not feel judged. To me, this means I am honest with patients and provide them with care and education that is evidence-based. Of course, all of this must be within my scope of practice, and I must know my limits. I believe that interdisciplinary care is crucial, and that when I don't know the answers, I need to be able to say, you know what, I don't know, but I will find the answer, or I will find someone that does. This also means I have to make appropriate referrals. This also means that I have to give them my best me. This means taking care of myself and finding balance in my life. I find balance in my life by enjoying things that I like to do, such as spending time with my husband and 2 little boys. I also enjoy being active, spending time outdoors, and spending time with my friends. On the other hand, there's an expectation that patients should be honest and forthcoming with me. They also should treat not only me, but my colleagues with respect. They must be willing to listen to the information I have to offer them, and then they can make educated decisions about their health care. One issue that pertains to treating patients as a partner in their healthcare is addressing the issue of getting patients in for an appointment or responding to them within a reasonable amount of time. I think to help increase continuity of care that we as providers should work as hard as possible to get patients in for acute issues so they do not have to go to the urgent care. Of course, I know this will not always be feasible. I also think that we should let patients know their laboratory imaging or any other diagnostic results as soon as possible. I think that too often patients are left waiting for way too long, and that this not only increases their anxiety and can affect their ability to function on a day-to-day basis based off of this anxiety, but it also has the potential to negatively affect that provider-patient relationship. And then lastly, being on a team with my patients means meeting them where they are at in their lives. I think that sometimes we have these expectations of patients and they're just not realistic. For example, it seems more realistic and fair to help a patient who needs to lose a significant amount of weight, set small goals such as losing 5 or 10 pounds at a time, and then celebrating those successes with them. I think that that is definitely way more encouraging. All right, and so as far as the political piece goes, when I think of politics and healthcare, the first thing that comes to mind is the Patient Protection and Affordable Care Act that was signed into law by President Obama. I definitely agree with parts of it, such as healthcare organizations being reimbursed for quality healthcare and not just the quantity of procedures being performed. I like the idea that everyone should have health insurance, but I'm not sure I like how high some of the insurance premiums are that I've heard people talking about. I do believe that every individual has a right to health care. I will say that I don't think it's fair that the insurance companies are able to dictate which providers a patient can see or which pharmacies a patient can have their medications filled by. And I know that some of this comes from the pharmacy's part to not being willing to match prices that other pharmacies are willing to charge for medications. But yeah, so I think that patients have their medications filled by a pharmacy that's convenient for them, and it seems unfair to me that patients are not able to get their medications filled at, say, a pharmacy that has a drive-through because the patient has difficulties getting out of their car. It just, to me, this just does not seem like it supports patient-centered care at all. Another issue that's related to the insurance piece that I'm really passionate about is an issue that's currently being dealt with in Montana right now, and it's in regards to life flight. There are issues with insurance as not covering the cost of life flight because the particular life flight company is not an in-network company, and so these patients are being struck with these astronomical bills because there's only so many life flight companies in Montana, and so insurance companies are saying that patients should have known that they only cover so much, and I do understand how expensive it is to maintain an aircraft and how much it costs to fly, because my husband is a pilot and we have friends who fly for life flight, but let's be honest, almost all costs related to healthcare are expensive, and how many people are going to say no to life flight because of the cost? Especially because almost always life flight is used in life-threatening situations. Montana is physically a large state, but there's not a large enough population here to support certain levels of healthcare here, and so it's not uncommon at all for patients to be life flighted to hospitals such as Harborview in Seattle, or Seattle Children's or Primary Children's Medical Center in Salt Lake City. And lastly, the legal portion. I'll just touch briefly on a few issues. I do think it's a patient's right to sue, especially if the facts point to negligence on the healthcare provider or healthcare organization's part. I also think it's a healthcare provider's right to call out other healthcare providers or healthcare organizations. I don't know my exact thoughts on abortion being legal. I have a hard time with this one because I believe that life begins at conception, but I also don't believe it's up to me to make decisions for an individual. And then as far as the issue of another hot topic I know is the right to die, I do think that a patient has a right to die with dignity, and I think it's our duty as healthcare providers to make every patient as comfortable as possible, whether terminal or not. And that's all I'm going to say about that. That's it, guys. Thanks for watching or listening.